As we said, we love getting to ask the wonderful doctors who are on this show our questions. So we thought we'd give you a chance to do it. It's Ask Dr. Marie time. All of you came on our website. You had great questions for her, and our medical contributor, Dr. Marie Savard, and I recently sat down, and she gave us some answers about everything from acid reflux to birth control devices, new ones, and also treatment of diabetes. Let's start with this, because we know so many people are on medications for acid reflux, and yet we're hearing now about hip fractures. We have a viewer email. I take medication for acid reflux. How is this going to affect my bones?
I'm getting this question all the time. There is a lot of research that shows the more you take, the stronger the medications, lowers your bone density, and raises the risk of fracture. Why is that? It turns out that when you block all that acid, you're not absorbing important vitamins, including calcium. And so as you lower the calcium level, you're increasing the risk for fractures. Prevacid, Prilosec, Nexium, those are strong and are meant to be taken for short periods of time, 6 to 8 weeks. There's a rare condition, Barrett's esophagus, you've talked about before on the show, that really does raise your risk of cancer. In that case, maybe you need lifelong medications.
The headline to me is we have to think about acid reflux medications as short-term and not long-term, every day for the rest of your life prescriptions.
Yes, it's not the magic bullet to get rid of that heartburn and indigestion. There has to be lifestyle. Don't eat late at night, minimize the alcohol at night, and if you need it for short periods, try the over-the-counter antacids. They're milder, don't block as much acid, and again, still use those short-term.
A contraceptive question. I'm interested in finding out more about the injectable contraceptive Depo-Provera. Does it work the same as the pill, or is it completely different?
Well, as it turns out, the injectable form obviously is a shot. It lasts for 3 months, and I guess that's the easy part of it. And the active ingredient is progestin. It's very similar to what's in birth control pills. The difference is this. The difference is there's no added estrogen. Estrogen was put in birth control pills to kind of even out the lining so that you would have a more even flow every month. When you're getting the shot, you're much more likely to have breakthrough bleeding, some bloating, some of the other side effects that the pill can cause.
And it's just as effective?
It's absolutely just as effective. The progestin is the active ingredient in all hormone pills, and it works by thinning the lining of the uterus so that you can't have a successful pregnancy, and it also stops an egg from forming every month.
Someone says, I have type 2 diabetes. I know some people who say they control it with diet instead of medicine. How do you do that?
Well, this is complicated, so just to start from the beginning, anyone who has type 2 diabetes, their pancreas is working overtime to make extra insulin. Diet and exercise can do a lot to help that insulin be more effective. Gradually, the longer you have it, your pancreas tires out and produces less insulin.
So diet can control it, and if you control it effectively in the early stages, can you forestall or completely prevent the risk of the long-term problem?
Yes, people need to hear it. Diet and exercise can absolutely make the insulin work better and let your pancreas rest and recover. It's a process, and the pancreas will recover if it's not beat up so much by the overwork that it has to do.
Thank you, as always.
I'll be back. Thanks.
Okay. Bye. And do you have still more questions for Dr. Marie? Send them to us, and we'll take the most asked ones and ask her on the broadcast for you. It's our website, abcnews.com. We'll be checking there. And you can also find information on what you should eat to help control type 2, which is late onset diabetes.